segued into my presentation, which told the assembled regulators that, in fact, if Mr. Singer was correct, and I believed he was, that the problem would not be hedge funds. It would be the regulated banks and brokers who were leveraged 30 to 1, many of which held glowing, toxic, radioactive pieces of the securitizations they could never sell.
Now, you were right about that. So what did the finance ministers then say to you?
Well, the German finance minister who was chairing the meeting thanked me politely and thanked Paul and then said, "But what do you think about hedge funds?"
So they just did not respond. I've read the communique, and the communique doesn't refer to any of your presentation. So what's the next great looming disaster?
Well, we've been pretty public in that the U.S. healthcare system is probably the most interesting large group of companies that are heading for major problems that we've seen in a long, long time. The U.S. spent 16% of its national income on healthcare, which is twice the rate of the rest of the Western industrialized world, which spends about 8 or 9%. And of course, if you've spent any time in America, you know our medical outcomes are worse than the rest of the Western. We have higher infant mortality, we have shorter lifespans, we have higher incidence of heart disease, cancer, and obesity, so on and so forth. So it's not working. Part of the problem is that we have a pseudo-socialized healthcare system in the U.S., but it's socialized for the corporations. The U.S. government pays half of all healthcare dollars, but there's no accountability. And the great example I use is that one company sells its pacemakers into the European health plans for about $5,000 a piece. The same exact pacemaker is sold to U.S. hospitals for $35,000 a piece. Healthcare is growing now at about 10% per annum in the U.S. top line versus the economy of 3%. So, I mean, for me, as someone who's got a sharp pencil and an eye for this sort of thing, this can't last.